I'm Dr. Justine Bukenya, a senior lecturer from School of Public Health, Makerere University, Uganda. I'm happy to present to you my project that focused on improving utilization of cervical cancer screening among female sex workers in Uganda. Sex workers everywhere are marginalized population, and they don't use services, freely and comfortably. Female sex workers in Uganda are accessing HIV and sexually transmitted treatment services free of charge from the main government hospitals. In these hospitals, also cancer screening services have been included. The female sex workers have a high HIV prevalence of around 38%, and many of them have multiple sexual partners. All these predispose them to high risk of contracting cancer cervix. Developing interventions that really encourage such a population at high risk of contracting cervical cancer is more than important and very relevant during this era, where we are trying to make sure that when women come for services, they get all services at one-stop center. I plan to conduct a baseline study so that to get information of why utilization of cervical cancer is low among people who are coming for HIV services in Mulago Hospital. Getting this information is going to be very useful to design interventions in form of messages that encourage sex workers to utilize cervical cancer, and having them screened early enough will provide an opportunity for early diagnosis and treatment, where we expect better results once managed in a timely manner, reducing morbidity and mortality among female sex workers. For this study, I conducted a baseline study among women who were attending the clinic, 517 respondents with an average age of around 24 years. Many of them had low education, as 55% of them had only attained primary level education, and the reported HIV prevalence was around 33%, which is far higher than the national of around 7.2%. Only 68% of female sex workers had screened for cancer cervix. And the reasons for not screening were mainly lack of information, fears that maybe when I go for the procedure, they're going to introduce funny things in my private parts, and some claim not to have time to go for the testing, yet all services are provided within one roof. When I started my leadership journey, I engaged my seniors, peers, and subordinates, people who I supervise, and all of them really rated me highly as a potential leader. Yet on my side, I felt I did not have all that, what it takes to be a good leader. So getting this feedback really has been, a motivation throughout my year of studying leadership, that yes, I think I have what it takes to be a good leader. So I was eager and attentive to learn everything that was being provided during the training. Strategically building partnership. I have a partnership for adolescent people who are advocating for adolescent health, involving people from Belgium, Harvard University, and 7 universities in Africa. I've also joined a network of people who are promoting menstrual hygiene globally. I've communicated the impact of studying or working with marginalized population as a way of encouraging them to improve on their health-seeking behavior and also reduce on morbidity. I'm strategizing on how I'm going to work with my seniors and juniors in the future. So my aim was to serve the less privileged as a leader, to make people who are really marginalized, to encourage them to take up services. However, there is still room to grow in my leadership skills to create more impact among other groups of women. So the baseline data collected so far is going to be very useful when I develop the messages and interventions for these marginalized people. And I plan to use the findings to write a grant where I'm going to try to implement this intervention in more settings where sex workers seek health services to encourage them improve on utilization of screening services. This has been an exciting journey, leadership journey. I started as somebody who had low esteem, not believing in myself, but the facilitators have really encouraged us and helped us to identify our potential, which we've done. And I'm happy that I took up this project, talking to marginalized people. This is just a start, but at the end of the day, I hope it's going to improve the life status of marginalized women moving forward. Thank you very much.